We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome Ronda Holman to this episode of Talk the Talk. Ronda Holman, also known as the Airway Champion, is a dental assistant who currently resides in Montana and has been gaining popularity for her posts on social media. Ronda's personal journey has been a major influence for her passion in airway health. Her online presence in the Airway Champion community has brought awareness to airway health and has positively impacted and helped those who suffer from chronic airway difficulties. She has joined forces with Dr. Galan to provide an educational platform, Airway Coach, to inform individuals on airway health as well as how it impacts their overall well-being. Welcome to this episode of Talk the Talk. Rhonda, we're so excited to have you.
Absolutely. Thank you.
Thank you, ladies, for having me. This isn't the first time that we've collaborated. I think you are brilliant, and you're making major waves in the airway health movement, and I am honored to be here.
Oh,
Thank
thank
you.
you. That
As
means
are
so much.
you.
Yes, exactly. You're definitely influencing, at least you're influencing me.
Yeah.
So let's start and talk about time frame. When did you become a dental assistant? How did you get into this whole airway space? Were you educated on airway space, or was this something you had to find out on your own? How did your journey start, I guess, and how did it get you to here?
Well, I guess first and foremost is I'm a recovering mouth breather and a former floppy tongue owner.
Okay,
That's how I like to identify as,
I love it.
Let's see. I've been in dentistry for 26 years, and it wasn't until 7 or 8 years ago I realized that all my patients were mouth breathers. And I was
Wow.
like, wait a minute, I'm a mouth breather. And it was because I went to a course on sleep apnea appliances.
Okay.
And so it was my whole office went, and we spent a whole day, like 7 hours, listening to all these experts talking about plastic you put in somebody's mouth that makes them breathe better while they sleep. And they're like, oh, you are going to be a saint when you tell these patients that if they're CPAP non-compliant or intolerant, you can give them an oral sleep appliances that brings their mandible forward and gets their tongue up and out of their airway, and they can breathe better. And then the whole way home, it's like a 2 hour drive from where the CE was to my home. And I'm thinking, not one of those presenters out of that whole 7 hour period told me why people can't breathe at night.
Oh,
They
wow.
just said
Yeah.
they spent 7 hours talking about plastic and the
Mhm.
different types of plastic and how you can sell people more plastic. And I'm like, something is wrong here. So I just started digging and I bought every book you could buy. I was voracious. I was reading and watching courses. And I went to like an orthotropics course, a mini residency in California with Dr. Bill Hang. And then I became healthy or habit start, healthy start corrector ambassador. And then we went to like ALF with Dr. Nordstrom, and I took every course, airway prosthodontics at Spear, and I kept thinking, okay, all these people are talking about different modalities of solutions, but still they barely scratched the surface as to when this happened and why it happened. And so I thought, you know what? There's enough experts in the world right now telling people about how it happened, but not really, they're not spending their time teaching people how to fix it
Mhm.
outside of plastic modalities. So,
Okay.
yeah, I became an airway coach, and I'm like, you know what? First, be N of one, right? So I figured out how to help myself. I have retractive orthodontics. I had 4 premolars removed. I'm like the classic case of not enough room for your tongue.
Yeah.
And I was like, okay, if I can help myself breathe better at night, I can develop protocols and programs to help other people help themselves breathe better while they sleep. And yeah, kind of took off. Airway Coach it's been an amazing journey. Like I have these coaching clients, and I see them completely transform. And most of, the people that I help they're sick and tired of being sick and tired.
Yeah.
They've been struggling to breathe for decades.
Yep.
And And I get these butterflies on my stomach, and then they'll send me this text like, I started dreaming again, or I slept all night, Rhonda,
Mhm.
or, like my tongue stayed up. No, and it's just like these little things that there's very few people they can share their wins with. And so I am super honored and lucky that I get to be a part of their journey to breathe better, honestly.
Mhm.
Are
Mhm.
you practicing as a dental hygienist in an office, or
I
you put that on the back burner a little bit?
I'm still clinical 3 days a week.
Okay.
Um, I do run the airway department in my practice, so I help people with oral sleep appliances, people on their OMT journeys to get a stronger tongue and more developed upper airway.
Mhm.
But the rest of the time, I spend coaching, I spend on social media, and I just released my book. Of course, everybody has to have a book, right?
Wow. Oh, yes, we need a book.
So
Very
it's
nice.
called Breathe Better While You Sleep. And
Okay.
it's a guide for beginners, people who just discovered that their dysfunctional breathing is wrecking their sleep and they want to know what to do.
Wow. Wow.
Oh,
Instead of
that's going to have to be
fix
added to our
everything.
library.
Yes,
Oh,
definitely.
that's amazing. Congratulations. That's such a
Yes.
huge honor and accomplishment
Uh-huh.
to put all of those thoughts into one place and to allow it to be something that's published for everyone else to
Yeah,
see.
yeah, that's amazing. Now, do you do a lot with educating other like dental assistants, dental hygienists, or are you more so focused on like the patient and that side of things?
I honestly do a little bit of both. So
Okay.
I'm also a coach for Ignite DDS, which
Okay.
is a dental coaching company
Mhm.
that I can help coach dental assistants on their journey to help their dentist
Yeah.
diagnose and treatment plan, modalities to help people breathe better. I just like working with humans.
Yeah.
I just there's something about these people that have tried everything else.
Mhm.
They've turned over every single rock and they've spent fortunes. I just talked to a guy like 2 days ago and he spent over $200,000 over the last 10 years trying to figure out what was wrong with his sleep.
Oh my
No.
gosh.
And like no one asked about his tongue. They were just throwing all these expensive things at him, like hyperbaric oxygen chambers, which are amazing, by the way, red light panels, blue light blockers, blockout lights or curtains, their oral sleep appliances, CPAPs, and even now, like they're trying to get the tongue stimulators in there, and it's not Western medicine's fault per se. I mean, the education system it's just it's not caught up with the science yet. So a lot of these people, they're throwing stuff at these patients that cost a lot of money and don't actually work.
Mhm.
Right. They
When it
require
comes
more than
to,
just that, what they're recommending.
Right, right. Working
yeah.
on changing what's happening inside the mouth so that they can maybe be more compliant with their CPAP or, maybe not need it. We don't like to promise that, but we all
Yeah.
see it.
Yeah.
We see when we,
Well, my favorite saying is human beings aren't innately plastic deficient.
yeah.
Plastic
Oh,
is
I
just
like that.
something,
Okay.
in the last 30 years, we figured out how to mold it and change it and use it on the body, but it's not something we're deficient in.
Right.
Right.
Um, and so I want to give people the power to fix themselves
Mhm.
Yeah,
instead of
absolutely.
plastic.
Definitely getting to that underlying reason and enough with the band-aids.
Are you identifying individuals with issues at your current practice as you're practicing 3 days a week? Are you noticing some of those issues and making those recommendations yourself now?
Well, I'm auxiliary, so I'm just
Okay.
there to help point out things like, hey, did you know your sleep shouldn't make you tired?
Got it. Yep. Okay.
Know that it's not normal to wake up several times a night to use the bathroom or clench and grind your teeth all night.
Mhm.
Did you know snoring isn't normal, believe it or not? I know you
Listen,
think it's
doctors have
funny.
not caught up with that yet.
They're not. They think,
Yeah,
it's like it's just so common. They
right,
consider it normal, but it's not
right,
normal at all.
right.
And so
Yep.
in dentistry, we have like this bird's eye view. We get to see people before they're diagnosed from their physicians. So we can see the clenching and the grinding and the front teeth wearing down and the recession. We can
Mhm.
see that tori, that's building up from all these nights of pressure. We can
Yeah.
see the elongated soft palates and the inflamed uvulas. We can
Mhm.
see these tonsils that are just, kissing. Like, yeah,
Yep.
how much air are you getting past that bad boy?
Right.
We
Yep.
can look at their nose and be like, how come you can't use it when you lay down? Like that, you think that's normal?
Right.
Or for us, gum disease and a rampant tooth decay, like all these things that come with the pH being so messed up from the mouth breathing.
Right.
And
Right.
so I get lucky because I get to see people before they're sick. So it's
Mhm.
been interesting.
Mhm.
That's wonderful.
Trying to
Being that you
convince them that they
changed.
have a problem. That's like a whole like it's a two-sided coin for sure. It's like
Yep.
one, like I get to be the hero to tell you that this stuff isn't normal. And also you're not sick and tired of being sick and tired yet. So there's a
Yeah,
good chance you won't believe me that this is an actual problem.
that's true.
True.
Yeah.
And that there is a solution that's kind of easy, but it
Mhm.
takes a little time to get into place and
Mhm.
have it become part of your daily routines
Mhm. Mhm.
or your nightly routines, I should say.
Yeah. What are, you are very open about your own airway journey and how you are a recovering mouth breather. I love that. What have you noticed change in your life by focusing on strengthening the muscles and having the tongue in the right place and nasal breathing?
Everything. I literally turned my entire life around.
Mhm.
When I started finally getting good sleep, I got to like experience who I was supposed to be. Instead of this wired and tired person, I had like ADHD like symptoms. I always had migraines. I kept going to the neurologist and saying, "What's wrong with me?" And they're like, "We don't know. Take an
Mhm.
Advil."
Yep.
I'm like,
Yep.
"Really? That's your solution to all,
It might
all
be
these MRIs
depressed.
and CT scans?"
Yep, exactly.
Like, take an Advil? Oh my
Right.
goodness. And so the teeth grinding is really what set me over the edge. I'm like, I don't want my teeth to get flat, and I don't want to sleep in plastic. And so I got to the point where I'm like, this isn't quality of life. Like how medical comorbidities start. I mean, every year it just gets worse and worse if you do nothing because nothing changes if nothing changes.
Yep.
Mhm.
And I I knew that there was a better side of life. I didn't want to just survive. I wanted to thrive like some of the healthy people I knew around me.
Yeah, absolutely.
And yeah, I mean, just habituating nasal breathing, getting my tongue stronger, getting a proper swallow, it gives me this clarity. And it's funny because like when I was tired, you make such bad choices. Everybody says, lose weight, stop eating sugar, ditch the caffeine. Why are you drinking alcohol? And I'm like, I make poor choices because I'm chronically tired. And
Uh-huh.
these are solutions that keep me stimulated. Either it's like an upper or downer, and I lived like that for 30 years.
Yeah.
Yeah, it's
Wow.
true.
Yeah.
Good sleep is addictive. It really
Mhm.
is. Like when you
Mhm.
wake up and you're well rested, it's like, I don't know, it feels so different than
Mhm.
when you wake up and you think you're rested
Right.
or you think you slept well.
Right. Mhm.
I may have to put you like in my husband's ear, when he's sleeping, so it resonates a little bit because it doesn't resonate from his wife.
Yeah.
That's just different.
Mhm.
It's different.
Well, here's the thing. I see a lot of patients that come through and you don't know how bad it is until it gets better. So if your baseline is always crappy, like you've always woken up with a
Right.
dry mouth
Right.
and with a headache
Mhm.
and dependent on caffeine,
Mhm.
you think that that's you and you don't realize that it's because you were struggling to breathe all night.
Mhm. Right.
So like instead of
Yeah.
fixing stuff, you were just on survive mode.
Yeah, it's all you know, so you have nothing else to compare it to. But it's crazy when they do figure it out and they're like, wow, I can't believe how tired I was. Like, this is what
Mhm.
restfulness feels like.
So true.
Uh-huh.
So true.
Uh-huh.
So we know you're a big proponent of Myo tools, and we're so grateful for your support with Spa Pal. You are our number one fan. We love it. Tell us a little bit about how you think these tools have affected someone's like airway health journey.
Mhm. Mhm.
Okay, so the first thing I tell people is like your tongue should be suctioned to the roof of your mouth when you're not using it. And that's a really hard concept for somebody who's never done that.
Mhm. Yeah.
What do you mean my
Yeah.
tongue should be suctioned? What's that?
Yeah,
Yeah.
where?
I'm like, wait, half the time, and you guys know this, they don't have any oral awareness. Most people don't. So, like, that's the last thing you think about is where your tongue is. You're like, what bills due tomorrow? Or do I have gas in my tank? I'm
Yep.
so hungry.
Right. What am I going to eat for my
Where that
next
tongue
meal?
is. And And it's I tell them I'm like I need you to develop a healthy obsession with tongue posture until the neurons fire together so they can wire together and you can reset the resting posture. And that is really hard to do with people that have jobs and kids and lives. And Spot Pal has been instrumental for a lot of my patients, especially the ones, who are so busy that they can't think about their tongue. It just is a natural guide to get their tongue up without them having to obsess about it. I would have loved if you guys were around in 2017. Because I mean, I had a really hard time. There was no social media at the time. There's like 5 people maybe talking about tongue posture.
That's
And
so
so, like, I had to do it all on my own, thinking, okay, one day it's going to reset, right? And it
wow.
was so much nicer because my incisive papilla is very shallow. Like, it's very low profile. And I
Mhm,
don't know if that's because of the retractive orthodontics.
mhm,
Um, but like, there's a lot of us out there that don't have a natural guide. And so having this guide that you guys make for us helps so much.
mhm,
Oh, that
mhm.
makes us so happy. You have
Yeah.
no idea.
Mhm.
And like I said, we appreciate your support so
Mhm,
much.
mhm.
We really
Sometimes
do.
we just need that extra tactile support, right? And we
Yep.
know that when things can be worked on in a passive way, like pop that spot pal in and go about your day, or go about cooking dinner or drive that car, those tactile cues are going to just keep that tongue where it's supposed to be. And that's when that neuromuscular re-education side of things can start to happen.
And especially for that
Yeah.
pediatric population who it's very hard to get them to practice or do their exercises, or they're so busy, which everyone is so busy, just giving them another way to work on this skill we're trying to redevelop or,
Mhm,
recreate,
mhm,
is so important. And I
mhm,
think it's beyond just that where my tongue, it's how that where your tongue is affects so much more of your health and awareness and
mhm,
well-being.
mhm.
Agreed. And I think we've just like, we're on the tip of understanding the tongue itself. Like, I think about this all the time. I'm sure you guys do too. Like,
Oh, it's
I go
great.
through like religious excerpts and they're like, control thy tongue. I'm like, I think they meant that literally. Like, I don't think they're talking about like, don't say bad things. I think they meant control your tongue, like keep it on the roof of your mouth. And then like, if you do any Chinese medicine research and they're telling you that if your tongue isn't up on the roof of your mouth, you can't close the circle of chi to maintain your energy levels. And I'm like, oh my God.
Wow.
And then you get the research now where they're like the tongue is a lymphatic pump. And
Yeah.
before we didn't think we had one, but like what if we have one for the head and neck, which where all the lymph nodes live? And then you think about like the vagal nerve. All
Yep.
these people living in fight or flight, what if their tongue was up there compressing the vagal nerve on the palatal surface and keeping them in a rest and digest? Like
Yep.
I think we're just now starting to understand the power of this thing. And, I always thought it was special because it was like the only muscle group connected at one end, and now the other ones had 2 connections. But I think it's just way more than what I ever imagined it would be.
I thought we loved the tongue. I think we found someone who finds the tongue
Ab-
even more fascinating.
Absolutely. I think about my tongue all day. It's so crazy. I'm like,
Mhm.
oh, wait, if I put it this way, and then I'm trying to think about it like from a patient
Yeah.
perspective.
Yeah.
It's just, yeah, it's crazy. Yep.
So, one of the things that I'm sure you see a lot, especially in your coaching, because a lot of the adults, when they were children, palatal expansion wasn't really a big thing back then. And now you have a lot of adults with these really narrow palates. How does that interfere with what you're trying to do? What could somebody know to help them know that maybe their palate is more narrow than it should be? What are some of your thoughts on that?
Yeah, I mean, I'm 45. I'm
Mhm.
that demographic you're referring to. I had 8 adult teeth removed prematurely because I didn't have room for them. They didn't realize my face didn't grow right. That's why my teeth didn't fit.
Right.
But instead of growing my face, they just took out the teeth. And so
Yep.
now I have less room for my tongue, right? Because we talk about the tongue box a lot of times. But what I see a lot is people don't understand it's your face, the
Mhm.
bone around the teeth that matters. And they all think, my tongue's too big, it doesn't fit.
Right.
Like, but is it your tongue, you guys? I mean, yes, to some extent, I think it's this and I think, the tongue can house fat cells in between the muscles. And I think that's a huge part of it. And these floppy tongues that aren't properly strengthened, yes, they might be bigger in diameter, but they don't realize that it's because their face wasn't grown by their tongue, that their tongue doesn't fit in the roof of their mouth.
Mhm.
And so I think that's the hardest part is teaching people that they can work out their tongue so that even if it doesn't fit because of the like anatomical deficiencies, it's a hydrostat and you can make it fit.
Yep.
And I feel so upset when patients go to these airway providers and they say, you need palatal expansion, but they can't afford it, and then they feel like they're out in the wild and there's no hope. And I think that's pretty much why Dr. Glenn and I decided airway coach needed to be a thing, because there are these people who don't have the financial means to do MARPE or Vivos or DNA or like all these different appliances. They can't physically afford expansion,
Yep.
but they deserve to know what life is like on the other side of restorative and reparative sleep with their tongue suctioned to the roof of their mouth.
Mhm.
And yeah, so that's my passion.
I think so much of it is at least for us, the providers are still not all educated about that process as much as there's the newer generation of dentists are. I'm trying to figure out the best way to say it. But they're more thinking, let's pull out the teeth, let's put in a habit breaker, let's, do all of, they're not in that space of, oh, I should be growing the face or I should be watching that facial development, because it's all about now, like what they learned back then and not evolving with the times.
Yeah.
Even we're seeing more and more individuals with adult expansion. Do you see that a lot by you?
Not so much in Montana. There's more cows than people here, so I don't have a whole lot of people caring about their tongue box.
Okay.
But what I do see the dentists, they do the best they can, right, with the knowledge that
Yep.
they have. And
Mhm.
this isn't in the curriculum. It's all continued education, like us learning this later in life.
Mhm.
Um, and I think the problem is that most of the avenues for these guys to learn about this airway epidemic is usually in modalities. So they'll go to a course about, this brand new, latest, greatest appliance. Come to our course over the weekend. We'll tell you all about airway health and our solution that you can put this metal and acrylic and plastic in someone's mouth and, grow their face. And that's, what is it? If you're a hammer, everything looks like a nail. And so it's a little tricky.
Yeah.
And that's why I think airway coaches, it's a good compliment. I mean, especially we have a lot of dentists that are like expanding the maxillas,
Mhm.
and they're coming to us and saying, okay, we created room. Can you help them? Can you
Yeah.
like
Yep.
get them
Yeah.
to get their tongue up and hold that space
Mhm.
and help them breathe better? And you guys know,
Yeah.
it's the tongue is the main driving factor, but there's a lot of tributaries that come into this poor sleep, poor breathing stuff. So it's hard because dentists don't have the time. A
Yeah.
lot of
Right.
this is behavior modification.
Right.
Yep.
And that's kind of why I wrote the book, because I'm like, here's the deal. Like, nobody has the time to sit here and tell you A, B, C, D, E, F, G has to happen if you
Yep.
truly want to move the needle.
Mhm.
They say, well, I can change the anatomy, but the soft tissue and the muscles, that's on you. Like, you have to like go to another person over here and then go over there, and it's a lot.
Yeah, yeah. And I think a lot of the times a missing link still happening in the ortho side is the myofunctional therapy. Like don't fix the problem, don't fix the symptom until we can really get to the problem. And, let us train that tongue and get the tongue where it should be. Now, when you put the braces on, the tongue won't undo what you just spent time and money doing.
Yeah, I tell people all the time, I don't really work with a lot of kids, but the parents, they're already victims and they don't want to see it happen to the next generation. And
Mm-hmm.
so they're like, what do I do? I'm like, listen, if you go in for a consult and your orthodontist doesn't say anything about the tongue and lips, you need to call and schedule a different consult somewhere else.
Yeah,
Yep.
yeah,
Exactly.
Your,
yeah.
Yep.
your guy's going to make your kids sleep in a plastic retainer for the rest of their life and never really address what caused the damage.
Right, right. And, seeing things as just straight teeth, that's not what it's always about. It's not about the straight teeth. It's about everything else and making sure that the oral cavity is functioning the way that it should. And that's not just shown by straight teeth.
No,
Yep.
definitely not.
It's just camouflage at the end of the day. That's everybody's like, wow, Rhonda, you have such a pretty smile. I'm like, great, my tongue doesn't fit.
I
It's
love
really
it
pretty,
too,
but it
but
suffocates me at night, just so you
right.
know.
Yeah,
Mhm.
and they probably look at you like, what? What's happening?
Yeah.
What percentage of the dental professionals near you have a good grasp on the tongue and myofunctional therapy and the benefit and airway space?
I think we're averaging about 20% right now in the general population. I went through all the local orthodontist office and I had them like I went through their websites and look at their intake forms. And I was pleasantly surprised at how many orthodontists are now putting on there. Does your child mouth breathe? Do they clench and grind? Do they snort at night? I'm like, yes.
Wow, that's
Yeah.
great.
I don't know what they're doing with that information, but at least they're asking it. So
Yeah.
I have major hope that people like me aren't going to exist in 20 years who had retractive extraction orthodontics.
Right.
Yeah.
Definitely. We're putting people out of business at this point, you know? Kind of like the bariatric surgery. Now you just go on Ozempic. Who needs to
Yep.
cut my stomach out? You know, I just need. What about in terms of oral surgeons or providers that are assessing the frenum as part of the problem? Do you see a large population, especially of the adults, addressing any frenum issues as part of this journey?
I think maybe we have three dentists in my town that will do a tongue tie release, and out of those three, only two of them maybe do a functional release, and out
Mhm.
of those two, only one does adults.
Okay.
Wow.
Yeah.
Okay.
You know what I mean? Like it's
Yeah.
the supply and demand. We have a serious issue when it comes to like providers that know what they're doing.
Mhm. Mhm.
And the more I learn about fascia, the more I realize that, maybe cutting and lasering isn't the only option for a lot of these people who don't have access to care.
Mhm.
I mean, there's so much we don't know about like different diets that can help you stretch out the fascia, different exercises that we can do to release some of the adhesions that we're dealing with, and what can you actually how can you compensate? Like if I think about this a lot of times, like I have a lot of people that do have like a class 3 traditional tongue tie, right? Anterior, posterior, whatever you want to call it. And all they have to do is get their tongue suctioned when their mouth is closed.
Yep.
Like their teeth are slightly apart and their lips are closed. So I just needed to go up like 3 millimeters. Like, what if they have a functional tongue tie, but they can go up 3 millimeters with a lot of work and time and due diligence and patience and dietary control. Like, I don't know. I have a very open mind about the human body and its ability to be manipulated.
To
Yeah.
repair itself, essentially,
Yeah.
right? There were myofunctional therapists back in the day, and we evolved continuously. So, no, it's interesting about the frenectomy. I know that even from the pediatric side, we work a lot with Scott Siegel, as the oral surgeon. He was saying that they really need a more proactive approach, not only with airway, but even looking at the frenum. It should be part of that developmental process, should be part of those developmental questionnaires you ask when you're at the pediatrician, you're at the dentist, or at the ortho. And so many times by the time they get to the dentist and the ortho, now they're 13, 14, 15. Um,
Damage is done.
damage is already done.
Mhm.
Exactly right. And, being able to educate about the early intervention, but
Mhm.
even more about doing the work after you have the frenectomy,
Mhm.
that is just starting to come around. And Scott is very big on, making sure we're doing the exercises before frenectomy and after frenectomy.
Mhm.
With the providers that you're seeing, are they making those same recommendations? Do you see?
Well, like I said, out of my three, I think one is probably seriously airway focused. So they'll do the 6 OMT appointments prior to the release and then
Okay.
the 6 afterwards.
Mhm.
The other ones, you call them up like, hey, my kid's got a tongue tie. They're like, cool, bring him in.
Right.
It'll take 5 minutes. You'll be done.
Yeah.
I'm like, okay, cool. And so like, and that another great way to screen, if you're
Yeah.
making a call for yourself or your child is like, if they're going to get you in tomorrow, then they're
Right.
probably not the guy you want to go to.
Right.
Um, it would my next door neighbor, my cousin, she is a midwife, and we talk about this a lot, like how they used to have the long pinky nail. And
Yeah.
so
Oh my God.
before these bottles
This
and
is my story. You're
showed up,
stealing my story. No, I use that all the time. Like the nurse with their nail.
yeah, they're like, there's your coke nail. Like, no, there's my tongue tie.
Oh my God. Well, I'm so, I say that all the time.
Yeah.
And then I make that joke and then I'm like, oh, yeah, I should have said that. But totally so true. And
Yeah.
so sanitary.
Yeah, right.
But I mean, if you wanted that child to live, they
Yeah.
have to, and if they can't eat, they die.
Right.
And
Yep.
so we've gone so far from common sense, it
Mhm.
seems.
It's so
Like,
true.
here, put a
So
nipple
true.
shield on it, or here's a bottle, or put
Right.
a needle in it and make the hole bigger so they don't have to suck so hard. And here's some acid reflux medicine when they swallow that air. Like, it's
Ah,
really sad.
yeah,
Yeah.
it is. It is.
It's like a cause, it's everything's is a cause and effect, but it's that immediate reaction that everyone's looking for.
Mhm.
And I think that's what's so hard about myofunctional therapy and changing tongue posture is it's not an overnight fix.
Right.
It requires time and commitment
Mhm.
and redoing things over and over and over again,
Mhm.
which I think sometimes becomes frustrating to our patients and their
Mhm.
families. But like anything else, you have to change something you do all day, every day for your entire life.
Mhm.
And now you telling me now you want to start this journey. Well, it means we have to unbreak what's happened. We have to break everything that's happened and move forward.
Mhm.
And, that's just sometimes too overwhelming, I think, for parents and forget the commitment to the practice and what happens at home. And honestly, that's kind of, well, part of the reason Spa Pub came around was because it was COVID and we were doing a lot of virtual therapy. And in our practices here, we do in person majority. We were doing a lot of virtual therapy and we couldn't tell if the tongue was actually on the spot or the incisive papilla through the screen. So it was like, okay, how do we do this? But then also thinking about all the habit breakers that we've come in contact with and how we couldn't do therapy with them.
Mhm.
And that's ultimately like how Spa Pub came about. And we only thing we thought about was like our patients and the myo patients. And then as we brought it into the world, people have said you have to think about this product for the 95% of the population who has no access to myo.
Mhm.
And at least if they can fix one thing, if it's just posture, and it gives them a better airway and has more space and it gives them more restful sleeping, it's better than not doing anything.
Mhm. Mhm.
And I would say we never thought of it in that perspective. We were always thinking like, okay, support the therapist, but it's really supporting like in health where you are. Like
Mhm.
if there's not a lot of providers, what can I do to get, and there's only so much of you to go around. What else can I do to support you?
Right. Mhm.
And that's
Yeah, and
really,
I think that because like virtual OMT is a huge industry right now. Like,
Yeah.
yep,
Yeah.
and like if they could just recommend the spot pal, say, hey, we're gonna start this therapy. Go ahead and buy this kit, take the mold, send it in. When you get it, we're gonna have a meeting and we're gonna show you how to use it.
Mhm.
yep,
Like, I can't be there with you, like in person, to touch your incisive papilla and show you where it is. But this little tiny device that you can wear 24/7 outside of
yep,
eating, it'll help you learn where it is. Like,
Mhm.
I think it's brilliant. And I actually really I get excited like seeing all these innovations in this space
Mhm.
because of the supply and demand. There's so many people struggling to breathe at night
yep.
and there's not enough therapists. They're like, okay, how can the industry support like
Mhm.
different tools and modalities that'll help bring awareness to it?
Mhm.
Do you see a lot of providers still using traditional habit breakers, whether it be the rake or the crib or
I don't personally see that outside of social media. I'm like, what
okay.
are they doing? Like
Yeah.
Yeah. Mhm.
like you're punishing this person for not having a proper swallow instead of teaching them how to swallow. Like that
Right.
doesn't make sense to me.
I
Yeah,
know.
I mean, even on Long Island, you would think like, oh, we have so many, so much everything at our fingertips. But, we'll see a patient on a Tuesday and all of a sudden they come back on Thursday and they have a rake or crib in their mouth. And we're like, what just happened? Like, when did this happen? Of course, we do what we can to educate the parents ahead of time, but sometimes they just show up to the orthodontist or the dentist and they're like, hey, this is what's going in. And you're like, wait, why? They're doing myofunctional therapy. We're changing the muscles. We're strengthening things. We don't need this type of metal blocking everything that we want that tongue to do.
Yeah, it's the whole pill for the ill. It's
Yeah.
so much easier for me to do something to you than have you change.
Mhm.
Yeah. Absolutely. Do you see a big difference in the shape of your face or the shape of the individuals that you're working with as they're going through this journey? Do you see a more definition?
You do. I mean, again, it's a little bit more than just the tongue. You know, we do different modalities like the myomunchie and the replenish myonozzle. Like I pull a little bit from each industry that's moving and shaking and changing things. You will start to see more definition in the cheeks because of the way the muscles develop. You'll start to see more of a defined jawline just from moving the lymphatic fluid and actually touching the face and working out these compensatory muscles start to relax, and then you get to work the right muscles, and people just look more refreshed.
Yeah.
Just a good night of sleep, and you don't wake up with those giant bags under your eyes, and your mouth isn't hanging open, so you get to have one chin instead of two.
Yeah. Oh yeah, I'm holding mine up right now. It's okay. And I'm glad you brought up the Myomunchie and Remplenish
Yeah.
because we are spending a lot of time at the end of last year and now the beginning of this year just working together with Mary at Munchie and Anders at Remplenish on integrating how we can integrate all of these things into therapy
Yeah.
because we were coming up against like, well, I had to pick. And you don't have to pick. We're all working on something different. It should be more about how we can work them together so no one feels the need to make a decision and I'm only committing to this. Now, yes, I know it's a cost to do each of them, but at the same time, if we're all targeting something different and they're tools that can be used in a passive way, I just feel like there is a benefit to our patients and then a benefit to the providers understanding that we're not encroaching on the other one's space.
Right. We complement.
Yeah, they're all a complement to each
Right,
other.
yes.
Exactly.
Yeah.
Exactly.
And there's not enough people that are supplying the solutions. So it's not like, it's funny because and we're just bringing this up. We're talking about like solutions, right? Lip
Right.
tape. When I first started learning about this topic, there was like 2 lip tape brands.
Yeah.
And that was in 2017. And now, I mean, you can go online and there's like 40, 50, 60. There's so many different people. Everybody's got to have their own brand of lip tape,
Right.
it seems.
Crazy. It's so crazy.
It was something that was so, rare to see. And now it's everywhere because
Everywhere,
people are realizing that the power of just functional breathing.
Right. Yeah. And social media has made lip taping and mewing like the coolest thing in the world. So now we're like, hey, myofunctional therapy is even cooler.
We're cool
Let me
too.
show you why.
Yep. Parents used to be petrified when we would recommend taping the lips.
Right.
Oh,
Petrified. We'd be like, okay, yeah, put the tape on and then bring the parent into the room. Let the child sit with the tape on while we're talking to the parents. They can see that they're still able to breathe. It's more about muscle memory. It was like doing a tap dance. And now everything you see is, let me show you how to lip tape and what it's going to do. And we have spoken to a few companies and we said, lip tape is great, but what's happening behind the lips? Like that's where Spot Power comes in. Like, let's figure out a way that we can work together so that it's not a band-aid because we don't want the band-aid. We want the actual change to occur.
Right.
And most of them, I would say, have been open to that because they know what they're targeting is different than what we're targeting. Kind of going back to the Munchie and Remplenish. Like we all have our lane. And we can stay in it or we can work together as a team and the team approach is always better.
Yeah, agreed. I mean, it takes a village, right?
Yep, absolutely. And do you feel like you've developed a good network of individuals where you are, or do you make referrals and you have a good network of individuals just even outside of Montana that you're making recommendations?
I do like Tooth Pillow. I mean, I love those guys.
Yeah.
They're almost all like they all I think they all came from MyoBrace, but they're just really like-minded human beings and
Yep.
they're kind of gotten this figured out for parents who are desperate. They're in these 4 corners of the world where there's no access to care and they're virtually seeing them, which I think is amazing.
Yeah.
I mean, there's so many in Airway Circle, Airway Health Solutions, like there's providers coming out left and right and putting themselves on these search engines, and it's been so helpful.
Right.
The technology's here where we can get, like I said, a lot of this behavior modification, right? You just got to
Yep.
know what to do. Like, just tell me what to do. And we're getting more people to tell you.
Right,
Yep.
right. Yes.
Yep.
And for like the people that are listening now that are all of a sudden like, wow, I'm a mouth breather. How can they find you more and how can you help them in terms of your coaching services?
Well, airwaycoach.com. I try to make it as super simple as possible. Airway Coach everywhere is how you can get to me. Airway Champion, and that's my social handles. It's the same everywhere. Airway Champion. I didn't want to identify as one thing. I just wanted to be a cheerleader for all the different things. Like I didn't want to be stuck in a box and saying I only do this and I only do that. I only talk. I'm like, no, I help all people, young, old, big, small.
Yeah.
Male, female, indifferent.
Well,
If you're
yeah.
struggling to breathe at night, I probably know someone who knows the answer if I don't have it.
Right.
And then Amazon, that's where the book is. Breathe Better While You Sleep. And we've got it on Kindle version, and there's a hardback and a softback, and we're working potentially on an audio version. That's gonna be a little tricky.
Wow.
It's a
Very nice.
guide, so we'll see how that goes.
That's amazing. And when was it released? Just recently?
January 1st, 2025.
Wow.
Yep.
Wow. That's unbelievable. Unbelievable. Would you ever think that you would be doing this and then writing a book about it?
No, well, first of all, I spent the first 5 years convincing people mouth breathing was bad for their health. And here I am writing a guide on how they can help themselves because they're like, how do I do this? How do I do that? What do I do here? I'm like, I wrote it down, you guys.
Right. It's here. It's right here. Yep.
All
Yep.
the tools, like in here, you'll see Spot Pal is listed as one of the modalities to help train your tongue. It's
Oh
in the
my
book.
gosh.
What
We
page?
made the book. I've never, oh my goodness. Excellent. Love that book. Love that book.
You made our night.
You made our entire night. No, I think what you've done and the message that you've been able to get across and has really, I mean, it's influenced us and we're in the field. I think for those individuals that are not in the field and they're looking for answers, you've made that very easy because your posts are all relatable. It allows you to kind of put yourself in that position or in those shoes, and make the change. And whether it be using your appliance or otherwise, it really it has had such a profound impact. And I want to thank you because a few years ago we couldn't convince a dentist or an orthodontist to address myofunctional therapy, and now there's all of us out there working so hard, and you at the forefront. So thank you.
Oh yeah, absolutely. And everybody, do you teach mewing? I'm like, I don't even know what mewing is, you guys.
Yeah.
Like I've been doing this almost a decade and like I maybe watched one or two of Mike Mew's stuff, but I don't really know what it is. I'm like,
Yeah.
I know it's based in myofunctional therapy, but it was one of those things that broke through. It became like a viral sensation. And
Right.
it, even if I don't know enough about it to talk about it, and maybe I don't support some of the things that from what I've learned, but it's just bringing awareness that your tongue posture matters.
100%.
Oh my
I
God,
don't care how
yes.
you figured it out. Like
Yes.
Right. And you're compensating terribly. So let me show you the right way to do it.
Right.
But it did bring good awareness to the world.
It really
it's
did.
one of those things, like it's one of those unforeseen happenstances where you're like, well, this is just one more movement in the right direction as far as like understanding that your tongue grows your face. And if your tongue's not there to do it, you're going to have problems.
Absolutely. Absolutely. Well, thank you so much for taking this time with us tonight. If you're ever in New York, we would love to meet up somewhere, somehow. Because I don't know, this is so enjoyable. So thank you so much for joining us and being put through the ringer with all of our questions. But again, we're just mention one more time for our audience where they can find you.
So Airway Coach is the website. Airway Champion is the social media. And I guess I also go by Ronda Holman, which is like my actual name.
She is. Rhonda's like, yeah, exactly.
Boring. Go to the Airway Champion.
What are
Way
your
cooler.
initials? AC. What do you mean? Not RH. AC. AC.
I know, like Clark Kent, like who knows that name? No, they know him by Superman.
Yeah, exactly. It's got to be a big T or a big M. I'm not really sure. It goes on your chest at that point. An A? I guess an A. Well, thank you again so much for spending time with us tonight. And I know our audience is going to enjoy this, and our patients and their families, which is really what we're trying to do, is just continue to expand your message and, our message as well.
Thank you so much.
Thank you guys for having me. I look forward to collaborating with you in even more in the future, because I don't see Spot Pal going anywhere but
We
up.
hope it was enjoyable and
thank you. We
educational
would love
and
that
further
as well.
supports you both
I think,
personally and professionally.
again, more
For
minds
more
together and
information,
more
please check out
thoughts
our
and more
Myo Mile
experiences, I
and
think
Myo
helps
Minute
to
podcast,
create
as well as
better
our
and better
other
programs
episodes
and
of Talk
better
the Talk.
awareness.
And
So,
don't forget to check
we would
out
love
our
that as well.
tongue training appliance, Spot Pal.
Thank you so much.
Thank
To help
you.
with
You have a
tongue
good night.
thrusting,
Bye.
thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.